Welcome to the first in a series examining the opioid crisis in Delaware's construction and maintenance industries. I'm John Volpe, Principal Consultant with Health Management Associates. Today we're joined by Carr, Community Outreach Coordinator from the Delaware Division of Public Health, and Jamie Chambers, Community Manager from the Delaware Contractors Association. Welcome to both of you.
Good morning. Good to be here.
So let's just jump right in. Anne, can you just talk a little bit about the realities of the opioid crisis nationally, but more importantly, what's going on in Delaware?
Yes, John. So nationally, according to CDC data, 128 people every day die from an opioid, from a drug overdose. So I think 70% of those are opioid involved. And unfortunately, we're seeing a lot more of that be fentanyl in those drugs. In Delaware, we've gone from being number 6 in overdose deaths in the nation to now we're number 2. So our data, the way data works is it's not actually current year. We're looking at 2018 data that we went to number 2. But in our reviewing our year-to-date data, we're going to be higher this year than we were at the same time last year in overdose deaths.
Wow. That's really devastating. So, Jamie, maybe you can give us a little more background on specifically the construction and maintenance industries and really what's happening there. Why do you think it's hit so hard?
Yeah, I mean, I don't think it's any surprise to either of you that construction is hard physical labor. You know, I think about my grandfather, my father, my husband, you know, they're all in construction, and it's a lot of hard work. A lot of technology is here now, which you think would help with construction, and it does. But in all honesty, I don't think a lot of people think about this point. Technology kind of drives the schedule of construction. So guys are putting in more hours. There's miscellaneous waves. And when you don't work, you don't get paid. So there's a lot of accidents. You know, I tell my kids accidents happen, right? And that applies to every aspect of life. In construction, there's a lot of accidents and falling, slips, you know, a lot of back injuries, even just back injuries from the hard labor. And people are going to doctors for some pain management, and kind of how it starts in construction is that's it. You get hurt. You go, you get put on medication to help you with the pain. The medications are really strong nowadays, some of the things that Anne talked about, and I think I'll talk about some more. And they're unfortunately becoming addicted to the pain medication. The pain medication, eventually the prescriptions run up. And at that point, you're so addicted to the medication that, to be completely frank with you, people start buying heroin. You know, you could buy a opioid, you know, a pill for $40, or you could buy a bag of heroin for $5. And nobody ever thinks they're going to go down this road. But, you know, you don't want to miss work. So next thing you know, you're, you know, using these opioids to just get yourself through the day.
Yeah. And what, any specific examples or anything? I mean, we're in this pandemic. Its own crisis. Anything related to construction and the risk for substance or opioid use and COVID, or any other kind of on the ground things you're seeing that you think is important to get out?
Yeah, I mean, in regards to the COVID, it has completely changed the construction industry. Construction workers were listed as essential personnel because they absolutely are. But there are a lot of new things that have come in to keep construction workers safe, to keep the public safe, and it's completely flipped things upside down. So if you're somebody who already struggles with addiction and stress, they kind of go hand in hand no matter, you know, where you are in life. The COVID thing has really fueled that fire, and it's completely changed things. And to give a hard example, you know, I know that addiction is everywhere, but just in construction, you're in the middle of your day, you're stressed, you're feeling sick. And to be honest, a lot of overdoses are happening in porta potties. I go on job sites a lot to talk about addiction and the help that is here in Delaware and in general. And every job site that I've been on, they have unfortunately had an overdose in a porta potty. And that is a harsh reality, but it's a truth. And it's why, you know, we're really passionate and want to work to get the information out there about the help that is here. There is nobody that you talk to that struggles with addiction that will tell you they love being an addict. It is a true struggle, you know, that they just need the help and support to get through, just like anything else.
Wow. And so we'll turn to you. I mean, clearly we've painted the picture. I think you guys painted it really well, but there is a lot going on in Delaware. The attention nationally is on the issue, but in Delaware also, you guys are really doing a lot. So can you just speak to some of the things the state is doing with the community and partners to address the issue?
Yes, well, John, as you saw on the pie chart, construction is 23% of the drug overdoses in Delaware. And statistically, that's men from the ages to 30 to 40 that we're saying. So we've started working with the Division of Public Health is working with the construction industry to educate and inform the people that work in the industry, the employers, the workers, on the risk of using opioids, some different pain management strategies we're hoping for, and also to address stigma around drug addiction. And some of the things that we've done is we've developed a flyer, which Jamie has worked with us on and distributed. We're working on a toolkit for the workers in construction industry. The state of Delaware also is doing Naloxone point of distribution events where you can get Naloxone. Naloxone is an overdose reversal drug, or medicine. So if someone overdoses, you know, the Naloxone can help them from dying. So we do know that a lot of overdoses occur in the home, and getting Naloxone either on the job sites or, as Jamie said, there were examples, or into people's hands is something that we're working on doing.
Maybe each of you could just quickly just comment about the role of employers. Clearly, you know, this is going to take the whole community to address this issue. Is there anything that we would want to flag for employers? Maybe Jamie, start with you.
Sure. I think from an employer standpoint, to be completely honest, they don't have a full grasp on how bad it is on their job site until it's too late. I think we kind of talk about squashing the stigma of addiction. You know, addiction is a mental health issue that I think employers themselves need to educate themselves about. There are a lot of programs out there that I know in the construction industry, employers are open and willing to be a part of and offer the help to their employees. I'd like to take a minute from the employee standpoint to say the help that is out there is just unending. A lot of people don't want to come forward for two reasons. Number one, they don't want their employer to find out because they're scared they'll lose their job. And number two, they don't know how they'll get help and still work. A lot of people might not be aware that there are programs in the evenings. So employers are willing to work with employees, and employees need to have the comfort from their employer that we're here for you. We understand that you're just struggling with a mental health issue and there are options out there. And to just go back for a second, Anne had talked about some of the percentages in the pie chart that we had shown earlier. 1 in 4 of the overdoses in Delaware are construction workers, you know, which we talked a little bit earlier about, you know, why is it so rampant in the construction industry? Again, it's just a vicious cycle of many, many things. And, you know, this is about the help is out there. And I know Anne could talk about that a little bit more.
Great, Anne, you have anything to add?
So John, I think, yeah, Jamie's right. If we do look at addiction as a disease and as a public health crisis that it is, and we can educate people and get them to understand that it isn't something that someone chose. Just like Jamie, no one chooses to be a drug addict and have their life spiral that out of control in that way. And so I think if we can educate the employers to recognize that it's in their, ultimately would support them as an employer in better attendance, less injuries, all the things that go along with someone who is struggling with addiction, that maybe, we can kind of reduce the stigma and get people the help that they need.
Right. And you both talked at different points about the importance of stigma and language. Is there anything you would add to what you've already, discussed around how we combat the stigma and really kind of get people all on the same page in terms of, as you said, Ann, this is a disease, a mental health issue, and there is help. Is there anything you guys want to add?
I think I would add that many people, stigma is a negative belief that someone holds about another group of people or about an issue. And I think many people in the community feel that people that suffer with drug addiction, it's a matter of willpower, which it's not. It could be a long discussion about how drugs change people's brain, but that's ultimately what happens. And I think if we can start educating the public in general on, we can reduce some stigma on using like person-centered language. So we would say a person with a substance use disorder, not a drug addict. Things like that go a long way in letting people feel comfortable to ask for help.
Yeah, I mean, kind of the grassroots of it for me is language. So the word junkie, to be honest, when you hear the word junkie, you're probably thinking of some really sick person hunkered down in an alley, shooting needles in their arm. Why are we still using that word? Educating about the mental health that is associated with the addiction struggle is one of the biggest ways we are going to get people to come forward for help. There's nothing wrong with you. You're just struggling and you just need help. And to educate their family and friends and employers on the same end of things. They're not a junkie. They're somebody who struggles with issues, just like people that struggle with, food issues and all, depression. It truly is a mental health issue. And that's one of our biggest things that we're trying to hit home across the board.
Great. Well, I thank you both. This concludes this conversation today. We're going to continue this series. There are resources, and I think both of you highlighted that if you or someone you love or someone you employ, this takes a community. So anyone who sees and has a person in their life who needs help, there is help in Delaware. So here's some resources. And clearly, we want to thank Ann and Jamie, and their contact information is here, and you can reach out to them. It's really, there's no wrong door. If someone needs help, you need help, reach out. That's the key to everything.
Yeah. Thank you, John.
Thank you.